Perioperative anxiety and pain in patients undergoing sequential LASIK surgery, comparison of the fellow eyes. As we know, refractive surgery techniques have evolved circumferentially over the past several years. With the abandonment of RK surgeries and the burst of PRK surgeries, it was soon eclipsed by the introduction of LASIK surgeries. LASIK became the mainstay because of the advantage of intact central epithelium. Still, despite the safety and advancement, patients do complain of pain and anxiety during the procedure. The study was reviewed by the Institutional Board Review, and particular consent was taken for the LASIK patient to participate in the surgery, also the participation in the study. The aim of the study was to analyze the patient's perception in consecutive eye undergoing LASIK surgery. The study design was a cross-sectional non-interventional observational study, and it took place between 2020 April, March 21 at a tertiary care center in central India. This was a patient performer where we enter the data of all the patient's basic details and the UCVA, BCVA. Along with that, a refraction, pachymetry, anterior and posterior segment findings were noted. The anxiety score was measured with the standard Amsterdam preoperative anxiety and informative scale, which consisted of 6 questions. 3 were for the anesthesia anxiety and 3 were for the surgery anxiety. This is a standard scale that is used for the anxiety. For the pain, we used a visual analog scale for grading from 0 to 10. The score in the APIS for the anxiety was divided into 2. The sum of anesthesia was set at sum A and sum of surgery was set at sum C. Sum C was sum A plus sum S. This preoperative anxiety was completed in the patient in the waiting room, and the postoperative pain was analyzed in the recovery room. Both were orally administered by a trained investigator. Along with that, we also measured the systolic BP, diastolic BP with the heart rate of the person. A complete ophthalmological evaluation was done before the operation. Both the eyes were operated on a sequential basis, and it was randomized into 2 groups. Group A, in which the right eye was operated first, and Group B, in which the left eye operated first. And it was operated by the same surgeon. The statistical analysis was used by the SPSS software version 13.0. And the results came that the study enrolled almost 101 patients, with Group A right eye operated first with 56, and Group B had 45 patients with left eye operated first. Female were the more predominant people in our study group. But despite the Group A in which right eye was operated, or in Group B in which the left eye operated, irrespective of that, the pain in the second eye was more compared to the first eye. And the patient also complained pain more during the suction and the speculum positioning. It was of mild intensity and dull in character. As we can see in the figure, in Group A, in which the right eye was operated first and the left eye was operated second, the pain score was 2 to 5 in the range. And likewise in the Group B, in which the right eye was operated first and the left eye was operated first and the right eye was operated second, in this also the pain score was more. The anxiety score was documented at sum A, S and C. The 2 were mostly comparable and insignificant in comparison. There was a slight change in the systolic BP in both comparing the second eye versus first eye, but there was no difference between the diastolic BP. Along with that, we also measured the other parameters and documented in a tabular form like pain, age, pachymetry, spherical equivalence, BP and pulse of the patient, along with anterior segment, and which was documented but did not show any significant association. In discussion, the LASIK is the current refractive technique aiming to provide a perfect vision. The advancement of keratome has increased the safety profile, but despite that, the pain perception and tactile stimulations are well experienced by the patients. The causes of pain during LASIK surgery can be during eyelid manipulation, where during placement of a lid speculum, a stretching of the orbicularis muscles can be there. Along with that, a suction ring can also lead to an increase in IOP, leading to pain. Microkeratome cuts and laser ablation can cause sensitization of corneal nerves. With that, in our study, the pain score were not correlated with the cooperation score, and increased sensitization to environmental factors were mostly seen. The patients, mostly with type A personality or highly anxious and highly irritable patients, had more pain in the second eye versus the first eye. These were the El Rami et al. Had documented the pain in second eye more than the first eye, and in a LASIK study where they also showed unclear reason for this and showed more of a psychological explanation or regional stimulation. This was another study where the preoperative pain profile was studied in different stages of bilateral LASIK. In this, they commented that there was more pain during the eyelid manipulation, and small palpable fissures were mostly complained of more pain, and they advised for a supplementary anesthesia in these patients. Then there was another which was done in the cataract surgery group, where they documented 3 theories for it: physiological, psychological, and pharmacological. Physiological can be because of the nociceptive advancement of the neural heads. Psychological can be because of the anxiety of the patients, because of the personality, and the pharmacological was not justified in the LASIK patients. Then another in PRK also showed no association. The limitation of our study is a paucity of data due to the limited questionnaire, and the VAS and the APIS was not, it was only included in the immediate post-op period. There could be an yes sir. There could be an inter-subject variability, and high pain score was seen in the female patients due to a biased gender. So the road ahead is an individualized pain score can help us in assessing the second eye, and proper anesthesia can be given. And the role of anti-anxiety and local anesthesia can be studied in future studies. Thank you.
Thank you, Dr. Sonali. What's the inference from your study?
So the inference, if the patient in the first setting, we see that the first eye has more pain, we can prepare the patient for the second eye. We can actually have more anesthetic measurements taken for the patient, and we can actually have distractive measures like the playment of a music or talking to the person can also help in decreasing the anxiety level of the patient in the second eye operation.
Pain and anxiety.
So you inferred that the second eye was always more painful than the first procedure?
Yes, sir. Yes, sir.
So any special inference that you could draw, any specific reason which was tagged to this?
So mostly 3 theories that is associated with these kind of patients. First is a physiological, because of the nociceptive stimulation of the nerve endings, which was not...
that was the cataract study that
yes, sir. But so the same...
cataract was not done sequentially, right?
Yeah,
on the same
it
day.
Was done... no, sir. 1 month later it was done.
Yes.
It was not a sequential surgery, sir.
So those were not sequential surgeries?
Yes, sir.
So you can't exactly correlate
yes, sir.
them with
yes,
the
sir.
LASIK surgeries?
Yes, sir. So they also ruled out the physiological and pharmacological, and because pharmacological, they said that during the second eye, the anesthesia that is used, that becomes resistant for the second eye till it comes for the second eye. But that was also not valid for the LASIK surgery, because the amount of local anesthesia we use is very less. So the psychological theory is much more appropriate in these cases, sir. And the reading of nociceptive factors is, it is not of our domain, sir. We are not that, there's no efficient methods by which we can measure the nociceptive stimulus by which it is causing the pain and anxiety in the patients, in the nerve endings.
So what about anxiety part between the first eye and the second eye?
This anxiety, sir, it was more in the second eye, but the association was insignificant, sir, in our study. But there has been study in other LASIK or PRK patients where they said there was decrease in anxiety, and because the patient was less anxiety, they experienced more pain, because they have become very desensitized with the environment, and when suddenly there was a stimulus, they felt more pain.
How objective is the measurements? What do you think is the subjective element in all these things?
Sir, it is, I would say, not very, very relevant if we are talking about the objective measures, because it can be person to person variable. So if a learned person is taking, he should, or the person should be acquainted with the whole procedure, and mostly the patients that we talk about, they're not very pre-acquainted with the procedure. We do try our level best, but some of them we miss out on.
Thank you. Thank you. Any other questions, Chaitra?